Right now, as you're watching this, your kidneys are working, filtering, cleaning, fighting. But what if they've been sending you distress signals for months, and you've been dismissing every single one? I've been a practicing physician for over 20 years. I've sat across from patients, good people, healthy-looking people, and I've had to deliver news that nobody ever wants to hear. And almost every single time, the first thing they say is, "But I felt fine, doctor, I had no idea." That phrase haunts me. Because in most of those cases, their body was telling them. They just didn't know the language. Today, I'm going to teach you that language, because kidney disease is one of the most underdiagnosed, most misunderstood, and most preventable health crises on the planet. Over 850 million people worldwide have some form of kidney disease. And shockingly, up to 90% of them don't know it yet. 90%. So stay with me through this entire video, because by the end, you'll know your body in a way most people never will. And that knowledge could genuinely save your life, or the life of someone you love. Let's start with something I want you to do right now. Think back over the last few weeks. Have you felt more tired than usual? Like a deep, heavy, won't-go-away kind of tired? Have you noticed any puffiness around your eyes in the morning, or maybe your ankles feel a little swollen at night? Have you looked in the toilet and thought, that looks a little different than normal? If any part of you just said yes, even quietly, do not look away from this screen. Your kidneys sit just below your rib cage, one on each side of your spine. They're roughly the size of your fist. And every single day, these two small organs filter over 200 liters of blood. They remove waste. They regulate your blood pressure. They control your fluid balance. They tell your bones to stay strong and your red blood cells to keep multiplying. Your kidneys are not just filters. They're the silent managers of almost everything happening inside you. And here's the terrifying part that most people never fully grasp. Your kidneys can lose up to 70% of their function before you feel a single symptom. 70% gone. And you'd still walk around thinking everything is fine. That's not a scare tactic. That's kidney biology. And it's why I call them the quiet soldiers of the human body. They keep going and going, compensating, adapting, fighting for you, long after they should have waved a white flag. But eventually, they can't hide it anymore. And when the signs do start to show up, you have to recognize them. So let's talk about the 7 signs your kidneys are desperately trying to get your attention. The first sign is fatigue that doesn't make sense. Now, everyone gets tired. I get tired. You get tired after a long week. But this is different. This is a kind of exhaustion that sleep doesn't fix. You wake up tired. You feel foggy. Your concentration dips. Your motivation flatlines. And here's why. When your kidneys aren't filtering properly, toxins start building up in the bloodstream. Your blood can also become less rich in oxygen because your kidneys produce a hormone called erythropoietin. That's the hormone that tells your bone marrow to make red blood cells. When kidney function drops, erythropoietin drops, red blood cells drop, and you're left walking around in a fog that no amount of coffee can cut through. Now here's the thing most doctors won't take the time to explain. This fatigue often gets misdiagnosed. People are told they're stressed. They're told they need iron supplements. They're told it's depression. And sometimes those things are true. But if your fatigue is persistent and unexplained, kidney function should always be on the table. The second sign, and this one surprises people every time I mention it, is changes in how often you urinate or how your urine looks. Maybe you're going more at night than you used to. Maybe your urine looks foamy, almost like there's a head of bubbles that lingers in the bowl. That foam? That's protein. Protein should stay in your blood. When your kidneys are damaged, they start leaking it into your urine. That is called proteinuria, and it is one of the earliest and most telling signs of kidney stress. On the other hand, some people produce less urine than normal, or notice their urine is darker than usual. Dark, tea-colored, or brownish urine can indicate that something serious is happening. Either extreme, more or less, matters. Your urine is your body's daily report card. Start reading it. The third sign is swelling, and I don't mean dramatic all-over body swelling. I mean the subtle kind. Puffiness under your eyes when you wake up. Ankles that feel a little tighter in the evening. Fingers that feel slightly stiff in the morning. This happens because when the kidneys aren't doing their job, sodium and fluid start to build up in your tissues. Your body is essentially holding on to water it should be releasing, and that retention shows up in those soft tissue areas. Eyes, ankles, feet, sometimes even the face. I remember a patient, I'll call her Sarah, who came to me complaining about what she thought was allergies. Puffy eyes every morning, slightly swollen ankles. She'd been to 2 doctors before me. Both said, try antihistamines. It took a simple blood and urine test to reveal she was in the early stages of kidney disease. She was 38 years old, fit, no obvious risk factors, and her kidneys were already struggling. The swelling was their cry for help. We caught it early. She got the right treatment. She's doing well today. But not everyone gets that chance. The fourth sign, and brace yourself because this one catches almost everyone off guard, is persistent itching. Not seasonal itching, not dry skin, a deep, constant itch that seems to come from inside you, often spreading across the back, arms, and legs. When your kidneys can't remove waste efficiently, certain minerals and waste products accumulate in the blood and deposit in the skin. This triggers an itch that lotions and creams cannot touch, because it's not a skin problem, it's a blood problem. It's a kidney problem wearing a disguise. The fifth sign is something I call the metallic shadow, a strange, persistent metallic taste in your mouth, or breath that smells like ammonia, almost like cleaning chemicals. When urea, which is a waste product, builds up in the blood, a condition called uremia, it breaks down into ammonia and creates that unmistakable smell and taste. Some patients describe it as tasting pennies. Others say certain foods they used to love suddenly taste wrong or repulsive. This often leads to a loss of appetite and unintentional weight loss. And because no one connects a weird taste to kidney function, it goes unaddressed for far too long. Now we're halfway through, and I need you to stay with me, because what I'm about to share next is where most people make a critical mistake. They hear these signs, they recognize one or two, and they think, okay, I'll keep an eye on it. And that is the wrong response. Because here's what most people don't realize. Kidney damage is largely irreversible. Once kidney tissue is scarred, it doesn't regenerate the way skin or liver tissue can. The goal is not to reverse damage you can't see. The goal is to stop it before it progresses. And that window is exactly why these early signs matter so much. The sixth sign is high blood pressure that doesn't respond well to treatment. Now you might be thinking, isn't that the other way around? Don't high blood pressure causes kidney problems? And you're absolutely right. High blood pressure is a leading cause of kidney damage. But here's the twist. Kidney disease also causes high blood pressure. They feed each other. It's a vicious, destructive cycle. Your kidneys help regulate blood pressure through a system called the renin-angiotensin system. When they're damaged, this system goes haywire. Pressure rises, vessels strain, and more kidney damage follows. If your blood pressure has been stubbornly difficult to control, even with medication, your kidneys deserve a close look. The seventh sign, and this one often gets dismissed as simply getting older, is muscle cramps and restless legs. Specifically, cramping in the lower legs, especially at night. When kidney function is impaired, electrolyte levels, particularly calcium, phosphorus, and potassium, become imbalanced. These minerals are essential for proper muscle function and nerve signaling. When they're out of balance, your muscles cramp, twitch, and protest. Restless leg syndrome, that uncomfortable, impossible-to-ignore urge to move your legs, has been strongly linked to kidney dysfunction. Yet millions of people suffer through it every night, never making the connection. So there they are, 7 signs: fatigue, urine changes, swelling, itching, metallic taste, resistant high blood pressure, muscle cramps. Individually, any one of them might seem manageable or explainable, but together, or even in pairs, they form a picture that demands medical attention. Now let me take a moment to bust one of the biggest myths I encounter, even among educated, health-conscious people. The myth goes like this: if my kidney function was really a problem, my doctor would have caught it by now. I hear this all the time, and I understand why people believe it, but the truth is, unless you specifically ask for a kidney function test, it may not be part of a routine checkup. A standard blood panel might not include a comprehensive metabolic panel every visit, and kidney function can decline significantly between check-ins before anyone raises an alarm. Your kidney health is not something to wait and be told about. It is something to actively ask about. Go to your doctor and say these exact words: I'd like my creatinine levels, my GFR, and a urinalysis done. Write it down if you need to. Those 3 tests together give a comprehensive picture of how your kidneys are functioning. Now let's talk about who is most at risk, and I want you to be honest with yourself here. If you have diabetes, you are at significantly elevated risk. Diabetes is the single leading cause of kidney failure worldwide. High blood sugar damages the tiny blood vessels inside the kidneys over time. If you have high blood pressure, we already discussed that loop. If you have a family history of kidney disease, polycystic kidney disease, or any autoimmune conditions like lupus, your risk is higher. If you've been regularly taking over-the-counter pain relievers, ibuprofen, naproxen, even high doses of acetaminophen for extended periods, your kidneys have likely been quietly absorbing that damage. These medications reduce blood flow to the kidneys. Occasional use is generally fine, but many people are taking them daily, sometimes multiple times a day for months or years. That's a conversation that needs to happen with your doctor now, not later. And here's something I find deeply important to say. Kidney disease does not discriminate. I've seen it in athletes who were dehydrated for years. I've seen it in people who ate clean, but took too many supplements with high doses of oxalate-rich compounds. I've seen it in young people who relied on energy drinks and fast food for years. And I've seen it in the most health-conscious patients you could imagine, simply because of genetics. So what can you actually do right now? What does protecting your kidneys look like in real, practical life? First, hydrate properly. Not excessively. That's actually a myth. Overhydration can stress the kidneys too, but consistently. Aim for pale yellow urine as your guide. Second, manage your blood pressure and blood sugar if you have either condition. These two are the top destroyers of kidney function, and controlling them is the single most powerful thing most people can do. Third, eat a kidney-supportive diet. That means reducing sodium, limiting processed and red meats, eating more plant-based proteins where possible, and being cautious with high potassium or high phosphorus foods if you already have impaired function, though the specifics should always be tailored by your doctor or a dietitian. Fourth, be very careful with medications and supplements. Always check with your physician before long-term use of any anti-inflammatory medication. Fifth, and I cannot emphasize this enough, get tested. A simple blood test and urine test are all it takes to get a meaningful read on your kidney health. The earlier you know, the more options you have. Because here's the hopeful truth I want you to leave with today. Kidney disease caught early can be managed. In many cases, its progression can be slowed dramatically or even halted. People are living full, active, vibrant lives with one functioning kidney. People diagnosed with early-stage kidney disease who made the right changes. They're still here, thriving, years later. But that only happens when you know, when you pay attention, when you take those subtle, easy-to-dismiss signals seriously enough to act on them. I've been in medicine for over 2 decades, and the patients I worry about the most are not the ones who come to me scared. The ones who come scared become my best patients. They listen, they change, they heal. The ones I worry about are the ones who never come at all, the ones who feel a little off, notice a little puffiness, feel a little tired, and tell themselves they're just busy, just aging, just stressed. Don't be that person. Your kidneys have been working for you every single day of your life without complaint. They deserve 5 minutes of your attention. If this video gave you even one moment of pause, one flash of recognition, please see your doctor. Tell them what you've learned today. Ask for those tests. And in the meantime, share this video. Send it to someone you care about. Because somewhere out there, someone you know is experiencing these signs and has absolutely no idea what they mean. And if you want to keep learning how to read the signals your body sends before they become emergencies, subscribe to this channel. Because that's exactly what we do here. We give you the knowledge your body deserves. I'll see you in the next one.